Hello, welcome to the Talking Michigan Transportation Podcast. I'm Jeff Cranston. Today's episode is going to focus on a troubling issue, but something that people are working hard to address, and that's mental health challenges in the road construction industry. Greg Brunner, who is the Chief Engineer and Chief Operations Officer for the Michigan Department of Transportation, has taken a lead role in trying to educate people about this and the need to talk about issues that they're facing, and hopefully through being out in the open about them, finding help, finding comfort in knowing that others are dealing with the same things. He recently spoke on a panel at the American Association of State Highway and Transportation Officials, also known as AASHTO, at their annual conference. And Greg has some real insights on why this is important to him, why he saw this as an extension of advocacy work he's been doing for safety, the safety of workers and drivers, pretty much the entirety of his career as an engineer at MDOT. And he also talks about some of the troubling statistics that have informed the conversation. Later, we'll touch briefly on some other news related, again, to work zone safety, and that is the approval by the state Senate of a bill that previously made it through the Michigan House that will allow for work zone safety cameras. About half the states use cameras in work zones to monitor speeds and initiate citations for drivers who exceed those speed limits, and they've made a tremendous difference, as we've touched on the podcast with experts advocating for this previously. It's lowered the crashes in those work zones and lowered the fatalities and injuries because of that. So I hope you enjoy the conversation. So Greg, thanks for taking time to be here talking about this important topic. I want to talk first about what's really driving this conversation, and that's your work, your advocacy for taking on mental health challenges in the road construction industry. And then secondly, maybe touch a little bit on some legislative movement that's positive from an MDOT perspective concerning work zone safety cameras, and our hope that that'll get across the finish line soon. But this panel that you were on at AASHTO in Philadelphia last month sounded really interesting. And just talk a little bit about what drives your interest. Somebody who's long been involved in safety and trying to find innovative ways to make the workforce safer in what they do, because the work obviously has its perils. But sure, most people don't think about the other part of that, the part that you don't, the part you don't see. You see injuries to the body, you don't necessarily see injuries to the mind. So talk about what sparked your interest.
Well, thanks again for having me today, Jeff. And again, this is something that's become very important to me. I know at MDOT, people kind of think of me as a big safety advocate in everything I do, whether it's work zone safety or traffic safety, occupational safety. Early on in my career, I was involved in traffic and safety design. So I looked through crash reports and see where there are issues and try to find engineering solutions to stop people from getting hurt or killed in traffic crashes out there. But what really sparked my interest in safety is when I got involved in traffic incident management training, where I was an emergency management coordinator for our area. So what I would do is kind of work with first responders in the area, whether it's police, fire, EMS, tow trucks, or even MDOT first responders, and how to respond when crashes or incidents happen to kind of clear the roadway, get things open faster, and most importantly, keep them all safe. I went out to lots of crashes and incidents. I saw lots of bad things that kept me up at night. I realized there's a lot more that goes on to these crashes. There's the personal impacts to the folks that are impacted out there, as these occur. And that kind of got me thinking even further. What can I do to not only clear these faster, but to stop these from happening, because it's horrible. So with that, I remember the first 3 crashes I went to that were fatal, I walked up to the state police and kind of talking to them, and they said, all 3 of them, they said this person would still be alive today if they wore a seatbelt, which really hit home with me. I looked at each of those from an engineering standpoint. What could I have done different on the roadway here to stop this person from dying or whatever happened? And again, it comes down to wearing a seatbelt, which kind of got me into as an engineer, how can I impact driver behavior? So what can I do to make them wear a seatbelt or make them want to drive safe? So I started talking a lot about towards zero deaths to anyone that would listen, just kind of giving facts of what's going on our roadways out there, trying to make a difference there. And then from then, I got more involved in work zone safety and the work zone safety task force in Michigan, where we partner with the contracting industry to see what we can do to keep our work zones safer. And I know we'll talk about that a little later with our work zone safety cameras that are going through legislation right now. But kind of as a result of that, what I started doing just for awareness is wearing orange every Wednesday, which everyone sees at work. Quite a few other people do it as well. And during Work Zone Awareness Week, I bought an orange suit, which stands out and gets lots of compliments whenever I wear it. So again,
or at least lots of comments.
That's right. Either way, it's getting noticed, and that's what I want to do. And I've also kind of overseen our occupational safety area there. And so again, looking at making sure people are wearing the proper hard hat, safety vest, those types of things when they're out in the field doing the job to keep them safe. But kind of what really sparked my interest in the mental health side of things is I was asked to be on a panel at our Consulting Engineers Conference last year and to talk about mental health. And I just kind of started thinking that, what do I know about mental health? How's it impacted me? And I just started thinking of what our department's been through in the last 4 or 5 years. I started thinking about just the number of suicides that have happened in the department, and that far outweighed a lot of the other safety initiatives I had focused on, whether it's work zone safety or traffic safety, occupational safety, those types of things. I was so concerned about making sure people wore their hard hat. I wasn't really thinking about what was going on under their hard hat. So again, this is something that's not just a Michigan type thing or MDOT thing. This is something that's going on nationally right now that's being talked about, which I was pleased to see it happen nationally at that ASHTO conference recently. But when you start looking at stats overall in the construction industry, that has the second highest rate of suicide out of any industry in the U.S. behind mining. And, when you start thinking about it, construction's a high stress job. Everything's low bid. So there's tight time frames, tight schedules. You're away from your family a lot, long hours, those types of things all build up with mental health that's going on out there. And when you look in the U.S., there's almost 50,000 suicides a year overall. And in 2022, 5,000 of those were from construction folks. 2023, 7,000. So that number is increasing. And those are just national numbers. But when you look in Michigan, in 2022, construction suicides increased by 65% overall, which is a huge jump. And kind of overall, when you look at construction itself, you're 12 times more likely to die by suicide if you're a construction worker than an occupational hazard. So again, that was kind of unbelievable to me.
Yeah, those stats are unbelievable. And we know that mental health issues increased tremendously in all age groups and certainly across other industries too. But during the pandemic, and now that we're a couple of years out of it, and some people have, gone back to complete normal and maybe even forgotten what it was like there for a couple of years, especially that first year, these mental health challenges remain. What did you hear in your panel from the experts and people studying this? Why they think that is? Is there something? Are the pressures greater because of people driving faster? I mean, that's obviously a phenomenon across the country. We saw that started with the pandemic and has continued. Is it just a whole bunch of things?
Yeah, it's just kind of a whole bunch of things. There's not one kind of silver bullet solution to this. People tend throughout the pandemic and remote work and other things, people are a little more isolated, so it might not be as easy to see something going on. But kind of what it boils down to, at least in the construction industry and other areas, a lot of it, when you think about construction workers, lots of those are males. And so, kind of growing up, if you're a man, you're taught to kind of be tough. And if you're going through these types of things, to bury it deep and push forward. So there's a lot of internalizing that goes on with this, and just kind of the more or less the stigma or taboo that mental health isn't really something to talk about. When you start talking about physical health, people are fine to tell you, I broke my wrist or I have a sore throat or hurt my knee or whatever happened. But it's not like that when you start talking about mental health. There's just a stigma associated to that. Like if I mention mental health to a group, they're going to say anxiety or depression or suicide or bad types of things. They aren't thinking about mental health as kind of work-life balance or disconnecting from your phone or exercising, or what do you do to kind of clear your head to relieve a lot of those stressors that we all get day to day. So again, a lot of it is just, I think, the stigma or perception that if you do talk about mental health, there's some sort of weakness there. And that's kind of what I'm trying to get over, is just to start the conversation. Again, I'm an engineer. I'm not trained to be a social worker or a counselor or a therapist like that. I'm just an engineer that's trained to find solutions. So the best thing I can do, I think, is just start the conversation, get people talking about it so that they can get the help they need.
And you've found that there are, obvious benefits. I mean, it's almost like a spontaneous support group can break out when you start talking about these things and somebody shares something and then others find comfort knowing that other people have similar experiences. Can you talk a little bit about that and how that went at this particular panel?
Sure. And actually what I mentioned on the panel is just within our department, within the Michigan Department of Transportation. What we recently did is started employee resource group tied to mental health. So again, this is something that just kind of sparked up. Two people actually volunteered to lead that group, Liz Wilson and Joya Collins Lightfoot. But what they did is just kind of put an ad out in our communication that we're starting a mental health group. We set up an initial meeting, which was just to kind of see for anyone that was interested. And to be honest, I didn't know if anyone would even show up. It might just be the three of us there talking. But the meeting started, and I was surprised to see about 50 people, over 50 people attended. And that's about 2% of the department's total employees, which just blew me away. And again, I didn't know how the conversation would go, but people started talking and sharing experiences and things that had happened. And, that I think it was an hour meeting, and we didn't stop short. We could have kept going, I think, just because people started opening up to talk. And what I heard kind of after the fact even is that people within the department that didn't know each other would call someone from that meeting that shared an experience just to continue the conversation. So things kind of took over organically from there to continue those conversations, to keep moving forward and keep this on everybody's radar, it just blew me away kind of how that started initially, which was fantastic to see.
Obviously, we're not going to get into who, but can you just talk about some of the kinds of things you heard?
Yeah, sure. Lots of people dealt with suicides from people they knew, or talking about depression or other types of things and how they got treatment and how it helped. One person even said that they wish this group had been here 3 years ago when they were going through some tough times. So it was kind of a full range of discussion there, but again, all related back to mental health and how they deal with it and things they've done to be helpful on their end.
What do you see going forward, I guess? What's your best hope about what can come out of this? I mean, it sounds like you would consider victory if more people just feel comfortable opening up.
Right. And I think as a leader in the department, that's my goal, is to try to change the stigma associated with it, so that if somebody is going through a tough time and needs counseling, they get the help they need. We have some fantastic resources working for the state of Michigan. We have an employee support program that's totally free to all of our employees. I think sometimes, though, it's hard for people just to take the initiative to make that call there, because again, a lot of the perception is it gets back to being weak or something else, which is far from the case. So again, my goal is just to change the stigma, to see what we can do to make this work and kind of get this more on everybody's radar out there, because I don't want the numbers to keep going up. I know when you talk to anyone that runs a corporation or business, their employees are their number one resource. So anything we can do to make things better for those folks. I know lots of us that work for the state of Michigan, we're here because we want to make a difference. And so when I look at things, if I can save 1 million lives, that would be fantastic. If I could save 1,000 lives by anything I did safety related, that would be great. But at the end of my career, if I can say I save one person's life, I'll know I made a difference. So that's my goal with all of this, is just to make a difference.
Stay with us. We'll have more on the other side of this important message.
Did you know Newton's first law of motion states that a body in motion will continue moving at the same speed and same direction, while the second law states that an object acted upon by the force will undergo...
Wait, I thought this was a snowplow safety message.
It is, which is why this is relevant.
Don't you think that's complicating things just a bit?
Not at all. A snowplow weighs 17 times more than your average car.
Right, and snowplows tend to travel at slower than posted speeds.
So the third law states that action and reaction are equal and opposite.
I think it's easier just to remind motorists to give plows the room they need to do their jobs. Follow at a safe distance and don't drive into snow clouds. Things like that.
Well, if you're gonna make it that simple, why don't you just say, don't crowd the plow?
Great idea. Stay safe this winter. Don't crowd the plow.
That's it?
Yeah, that's it.
Do you think in talking to the Michigan Infrastructure and Transportation Association, they've got a focus on safety, and they have people that advocate and try to come up with creative and innovative ways and study, what goes on nationally. Do you think these conversations can lead to some tangible changes? I mean, can you think of anything that beyond getting people to talk about it and open up about things that can relieve some of the stresses and pressures of the job?
Yeah, again, there's definite benefit there. I know most of the industry in Michigan has had speakers at their conferences or other things tied to mental health. And a lot of it just gets down to day-to-day things that we can do different. I have some things I do. I'll go for a walk if I'm stressed out on my lunch break or after work, just or disconnect the phone, those types of things. But again, there's not a one solution for everybody. You have to find what works to you when it ties into this. But again, it's just keeping it on everybody's radar out there is, I think, the best thing we can do, at least from a starting point. If companies don't have some kind of employee assistance program or something else, that's something they could look into. But again, just let people know where the resources are and where they can go to get them, I think, is a huge first step here.
What would you advise a manager or a coworker when they see signs of a coworker perhaps having issues, but not wanting to talk about it, not willing to face up to the possibility that that's affecting them, affecting their work and their life? How do you approach that?
Well, to start out, it's not easy. I know when you ask anyone how they're doing, they just say fine, and that's about it. But at least in the department, we have resources that employee support or employee services program that can help managers start to initiate the conversation with employees. So managers have the ability to talk to them, to the counselors there, that can kind of give them almost a script to go through when they're talking to their employees about what's going on, what are the deeper issues and kind of what resources are available from that standpoint. So again, it all gets down to just starting the conversation, I think.
Yeah, I think so. I think one of your panelists said that there's a 75% remission rate for mental health and substance abuse issues if one stays engaged 6 months to a year in a treatment plan. Did that surprise you? Had you heard that before it came up during that discussion?
No, that actually surprised me. It was kind of an interesting panel there because there were people from different backgrounds. Of course, I'm with the Department of Transportation. There's one from the Association of General Contractors. Another was a doctor in substance abuse and mental health issues. And the fourth was a professor. Each brought a different perspective. So usually when you're on a panel, you don't learn a lot, but this is one of the panels where I actually had to take notes at the end on a few action items that I had learned there and best practices from others. So it was a fantastic session.
Yeah, and I think the AASHTO publication covered it well. I think used a good mix of the quotes from you and the other panelists. That one that I just talked about, that stat came from Richard Jones, who's the chief clinical officer at something called Your Turn Health. So very, very interesting. Well, thanks, Greg, for talking about that and for everything you're doing on that front. Let's pivot a second, related, obviously, to all of these things, safety in construction work and keeping the workers safer, which would obviously, if they feel safer, that reduces their stress, reduces the pressures on them that lead to these mental health issues. And that's long sought progress on doing what many other states do. About half of the states now have some kind of work zone enforcement, safety cameras that capture license plates and allow for sending citations to people that speed in work zones, because we found that no amount of public service ads or messages or signs, discussions, whatever, seems to be making a difference, especially again since the pandemic and the chronic speeding through work zones, putting workers at risk. So we're pretty pleased. The full Senate passed this bill, and the House just needs to concur because it had previously come out of the Michigan House. Talk about what you think this will mean for MDOT road projects.
Sure. Again, this is something that we're excited about. I had mentioned previously that I'm on the Work Zone Safety Task Force. And in talking to industry and contractors and even MDOT folks, the one thing that really scares them the most isn't necessarily the work they do. It's the drivers going by them at, 70, 80 plus miles an hour, looking at their cell phone, not paying attention to the work zone that they're in, or the person standing right next to them driving by at those speeds. So enforcement is always something that seems to come up, and we have a great partnership with the Michigan State Police for work zone enforcement, just to kind of keep people driving. Number one, keep their eyes on the road and keep them driving at safe speeds. So what this legislation would do, it would allow us to put in work zone safety cameras in our work zones, because I know the state police can't be everywhere. They have resource concerns as well. So it gives us another option to kind of reinforce the posted speeds through our work zones to keep everybody safe. So what this entails is these bills would allow us to get a contractor on board to put up these safety cameras within our work zones that would be able to, like you had mentioned previously, capture license plates and driver pictures, and then mail out citations to those that are speeding through the work zones. And these aren't like normal traffic tickets that have points and other things associated. The way the legislation is written is it's the first offense, the person just gets a letter in the mail stating that they were caught speeding through a work zone. The second offense would be a $150 fine. And then the third offense would be a $300 fine. So more, instead of getting them with points, it actually hits them in the pocketbook, which is a little bit of an eye opener for many folks out there, I think. And again, the goal of this whole program here is not for citations. The goal is driver compliance is what we're after. To be honest, I hope we put these out and nobody's caught speeding through a work zone. That's my goal when it comes down to this. Because what we've seen, like you had mentioned, about half the other states have these in place right now, and the results they've seen from those are amazing in terms of changing driver behavior. And that's what our goal is here, is to change driver behavior to keep everybody safe.
Yeah, I've spoken a couple times on the podcast, Juan Paiva in Illinois, the Illinois DOT, who was a driving force in getting them there. And he has some great success stories about what a difference it's made in terms of the work zone crashes and saving lives. Talk about where the money will go, because that's an interesting component too.
Okay. Yep. So the way this current legislation is set up is that any citations received would go to a work zone safety fund that would be held by the Treasury. So it's not a money-making initiative for MDOT. This all goes to a work zone safety fund. And what that fund can be used for with the department is to fund the contract for additional work zone enforcement and everything associated, the mailings and everything else from that standpoint. So it's kind of would become a self-funding initiative the way it's looked at. Any excess funds then left over at the end of the year would go to libraries. So again, it's definitely not a money-making initiative. The goal here is to keep everybody safe.
And the funds will initially go to the Department of Treasury, correct?
Correct.
I think that's important to note that this isn't just, like you said, this isn't like MDOT trying to raise revenue. That's not what this is about. Well, thanks, Greg. We'll be talking more, and I know that MITA, the operating engineers, the laborers have all been big advocates. They've all testified at committees and pushed, and it's taken a long time. But this is a testament to everybody's perseverance. I think that we're so close to finally having this legislation be a reality.
Right. Yeah, I know it's been in the discussions for a while, so it's good to see it taking another step forward.
Yeah, absolutely. Well, thanks. I know you're getting ready to start a weekend of deer hunting, Michigan tradition. So good luck out there. Be safe.
Sounds good. Thanks for having me, Jeff, and stay safe.
like to thank you once more for tuning in to Talking Michigan Transportation. You can find show notes and more on Apple Podcasts or Buzzsprout. I also want to acknowledge the talented people who help make this a reality each week, starting with Randy Debler, who skillfully edits the audio, Jesse Ball, who proofs the content, Courtney Bates, who posts the podcast to various platforms, and Jackie Salinas, who transcribes the audio to make it accessible to all.